Garcia here, one of the sports and cartilage surgeons. Today we're going to show a video testimonial. This is a patient, 39. Initially just came in with a lot of anterior knee pain and also some medial knee pain. And so we got an MRI, found that she actually had 2 defects in addition to a tear of her meniscus. So it's a little bit different. There's a combination of both. And both were actually symptomatic. So this is one of those situations where eventually she ended up getting a scope. We found the defects and we talked about a surface replacement called MACI. For these kissing defects. In addition, we talked about fixing the meniscus because she was having pain there and we were concerned that that would be a further issue later on. So actually we did both at the same time, and you can see she did quite well. You know, it's a long recovery. Again, you got to wait 9 months to a year for this to grow back, but the proof is in itself with the testimonial, so enjoy. Thanks.
So I started having knee pain right behind my kneecap, and it got worse over a couple years, until the point I couldn't take stairs without pain. I couldn't do squats, climbing, rock climbing, playing with my kids were just kind of off the table. I tried PT, that didn't really do anything. So once I did the MRI and I found out that there was a defect, it was a little bit of a relief because it was something that was fixable. It wasn't like arthritis or anything like that. And once I came here and got more information, it was again kind of a relief knowing like this is the process, we're gonna go forward with the MACI, and even if that for whatever reason didn't work, there were backup plans, you know, contingency plans for that. So the recovery from the MACI was slow because, you know, trying to be really conservative, making sure I didn't delaminate the graft. But it's been steady, just kind of marching along. Every month, it just seemed to get better and stronger, less painful. Broader range of motion, and again it's been slow but very steady, and the rehab plan has been laid out really nicely for me, so I kind of knew what to expect from the beginning to the end.
Perfect.
My knee feels amazing. I don't have any pain, which is it's kind of a weird thing to get used to because I'm like just waiting for like that pinpoint pain again, but it just never comes, which is like, it sounds dramatic, but like feels like this life-changing thing because I can just go about my day and not have to think about like, I have to, you know, change the way I move to avoid this pain, or, you know, not do the exercises and activities that I want to do. So it's been like, I don't know, full of hope.
If someone had the same issue as you, would you recommend this surgery to them?
Yes, absolutely, and I have.
Perfect.